Hi guys, welcome. I'm so glad you guys could join us here today. I have a lot to share with you. I am Dr. Amy Haas. I work at Path of Life Chiropractic Health Center in Nashua, New Hampshire. The reason that I wanted you guys here today is I have a lot of information with respect to your chiropractic care that will help you get the most value out of the care that you're getting here. So I came to chiropractic care 10 years ago as very much a critic. I am a trained scientist. I actually have a PhD in biochemistry. I worked at Harvard as a researcher, and when I first came to chiropractic in this very office about 10 years ago to the month, I was very much a critic. I was like, really? Okay, that sounds good, but prove it to me. Show me. Or in the immortal words of one of my mentors in grad school, Dr. Jennifer Morris, show me the data. That's what I'm here to do today. I spent a lot of time thinking through what is the science that supports chiropractic care and how can we share this with people so people understand better what it is that they're getting from their care. So here's a question. As a scientist, I know that just because something hasn't been published in a prestigious peer-reviewed journal doesn't mean it isn't true. My classic example for this is Newton. I'm pretty sure that Newton knew gravity worked before he published his theory, right? The field of chiropractic care is relatively young. It's just over 100 years old, and yet there is a lot of clinical data, observations from hundreds and thousands of doctors that show one basic simple thing, that chiropractic care helps the body to work better. And we can see that time and time again with the results we see in our patients. So me as a scientist, I ask the question, how does that work? What's the data? So what I want to share with you. One thing that I used to be in this position of the patient stating this, but now I have people coming up to me saying, oh, I love that you're a chiropractor. I believe in chiropractic. That's always tough for me as a scientist to hear, because when someone says they believe in chiropractic, it's almost as though you can't understand the science, you just have to believe in it as though it were a religion or something, or a cult or something like that. And chiropractic is not anything like that. There's very solid science that backs us up. Physiology, neurology, that's what I'm here to show you today, the science that backs up what it is that we do. So that when someone asks you, so you go to a chiropractor, oh, I believe in chiropractic. You can say, I more than believe in chiropractic. I know that it works, and I know why. And you can give them concrete examples. So we're going to start by defining what it is that chiropractors do. We look for subluxation and we correct subluxation to help the body work better from the inside out. So what is subluxation? This is a review for you guys, since you're already very familiar with this topic, but some people in the audience may not be. So subluxation is a misalignment of the spine that causes some kind of interference to the function of the nervous system that lives within the spine. What exactly that interference is, we're going to get into that. But right now, for the simplest version, I want you to think of it this way. A subluxation is a state of less light. Literally, the words sub is under, lux is light. It was originally chosen as a term to indicate a state of diminished brightness. So when you're walking into a room, you don't really have a total gauge for how bright the lights are or are not. If the lights were halfway down and I turned them up right now, you would only know once they're up that they were dimmed. It's the same way with subluxation. So you don't really know that the light has been dimmed until someone turns the light back up. You don't really know that subluxation is dimming your life force until someone clears subluxation from your spine and you experience the clarity, the lightness that is health. So long-term uncorrected subluxation, in a sense, it dims your long-term health potential by not allowing your body to work at its best. So another analogy someone told me last week, which is a pretty good one, when you're driving along the highway and your windshield is dirty, you don't even really think about it. You just kind of look through it. And then you go to the gas station, you fill up with gas, and you clean off the windshield, and you're like, oh, that was really kind of dirty. because next time you're driving, everything is clean, crisp, and clear. That's what life looks like when you have eliminated subluxation from your spine. So we're going to come back to this analogy of the light being dimmed a couple times during the course of this presentation, because it applies in a couple of different paradigms. Self-explanatory, chiropractic indeed lights up your life. So I'm going to show you 6 different lines of evidence that show how chiropractic care, how subluxation interferes with the proper function of your body and how chiropractic care counters that situation and corrects the problem. The first thing we're going to talk about today is how subluxation decreases communication within the body. So if you could think of the body this way, the brain is the master organ that controls everything in the body. It is the computer, it is the wiring, it is the circuit breaker. Everything in your body happens according to this paradigm. Your brain sends a signal to your liver, to your pancreas, to your arm, to any of the above, and then that organ sends something back to the brain. There's a feedback loop. So there's instructions out and then feedback back in. In chiropractic, we call that the safety pin cycle. So feedback in, instructions out, feedback in. Decrease in nerve transmission, does subluxation affect this safety pin cycle? Does subluxation physically decrease communication within the body, and what is the evidence that supports that? By the way, if any of the audience on YouTube or whoever's watching this wants these references, please email me. I'll be happy to send you all of these articles if you can't read what the references are. So these are 2 references that show that a decrease in nerve transmission has been demonstrated by several neurophysiology techniques, including nerve conductance philosophy and somatosensory evoked potential. Those are 2 solid electrophysiology techniques that show when a subluxation is present, the signal between point A and point B is corrupted. I would say that's pretty important if it's a signal between your brain and your heart. So when you have something that's interrupting the communication between brain and any of the above, you set up a situation that programmers refer to as garbage in, garbage out. If the brain can't hear the message, if the brain is not producing the proper message to send to the cells, organs, and tissues, what they're going to send back is also an inaccurate picture of what they're doing, right? So this is one of the ways that subluxation reduces the communication in the body and decreases your health from the inside out. So the second question, does the chiropractic adjustment address this problem? Does it correct the communication misfire in your body? And the answer to that is also clearly yes. This one was demonstrated by somatosensory evoked potential modulation of nerve transmission after chiropractic adjustment has been demonstrated by somatosensory evoked potential. This particular one, C-spine manipulation alters sensory motor integration, a SSEP potential study. Really beautiful study. I encourage any of you to grab that paper and give it a read. So, what is our role here? What is my role as a chiropractor? I literally help to clarify the communication between the brain and the body. So in this analogy, we connect the brain and the body, because I would prefer to have my body and my brain connected. They like to talk to each other. They've known each other for a little while. So, second way that subluxation interferes with your health potential is it decreases oxygen perfusion in the brain. And I'm sure you've all been in a situation where you've not had enough oxygen in your brain and you don't feel especially great, right? So, the brain needs to get oxygen through blood and through a fluid called cerebral spinal fluid. Cerebral spinal fluid is filtered from blood, so it's actually the same thing and has the same chemical makeup, it's just missing the red blood cells. Cerebral spinal fluid circulates around in the spine and parts of the brain to bathe the nervous system tissue in oxygen. So cerebral spinal fluid is produced up here, and it traverses down this canal here, you can see it in blue, and back up, and then is filtered out there. So there's a continuous cycling of CSF to make sure it is fresh with good oxygen. It actually pulses at 12 to 16 pulses per minute. It's funny, the original data from this observation was from a chiropractic technique called sacro-occipital technique. And they deduced this clinically from what they saw. Well, in the past 10 years, there have been wonderful researchers who've used a different technique called phase cine MRI who've shown this. Chiropractors knew this 100 years ago, and it took 100 years for the data to catch up with what chiropractors had already seen. 12 to 16 pulses per minute. This is cerebral fluid imaging by using phase contrast magnetic resonance technique. So here's a question for you. You all agree that's fairly important. What would a kink in the garden hose do in this respect? If you had, instead of your normal, healthy cervical curve, what if you had a kink in your neck where it was kinked forward? What's that going to do to the flow of cerebral spinal fluid, which carries the oxygen that your brain and your nervous system tissue need to survive and function at their best? Well, there's an example of a subluxated neck. If there's water or CSF trying to flow through there, you can see it's not able to take the path of least resistance. All right, so what's some evidence that shows that has a physiological effect? Well, here's your evidence. This is a SPECT CT scan series of people who had normal, healthy, C-shaped cervical curves versus people whose necks were subluxated. Oops, sorry. I'll come back here. Okay, so the red here is oxygen perfusion in the brain. I have one question for you guys. Which brain do you want? This one or this one? Yeah, I would prefer this one with a little bit more perfusion to the brain. This one is something I'd like to avoid, and I would think would be highly correlated with states like Alzheimer's, dementia, and states of degeneration of the nervous system, Parkinson's, MS. In this group of patients with neck and/or upper back pain, read subluxation, neck disability index, which is another indicator of subluxation, scores strongly predicted cerebral hypoperfusion. In English, what that means is when you're subluxated, it is highly correlated with not getting enough oxygen to your brain. That right there, I could stop this presentation right there and show you this is why everybody in the US should be checked by a chiropractor. To not do that is to ignore something as important to your body as blood pressure or heart rate, because your brain needs oxygen. So, very importantly, what does chiropractic care do to rectify the situation? Well, the work that we do, we take curves that have, this is a moderate loss of a cervical lordosis, and this is over the course of a year plus. This is actually my CA. So you can see here that this curve is greatly increased. We do the same thing also with curves that were reversed and have that kink. This is just a reconstruction that is not dissimilar to personal training. It's just neurologically very important. So far we've gone over how subluxation interferes with communication electrically in the body, and we have talked about how subluxation interferes with oxygen perfusion to the brain. That is like hitting the dimmer switch on a light from a couple of different directions at once. What if you have both of those? Are you 100% healthy? I don't think so. So, third thing we're going to talk about is how subluxation changes your neurology, which is the function of your nervous system proper. We're going to talk about balance in the nervous system first. Your nervous system is divided into a couple of different divisions. One of the divisions is called the autonomic nervous system. The autonomic nervous system governs the function of all of your internal organs, your heart, your liver, your stomach, your pancreas. And that autonomic nervous system is divided into two parts. One is called the parasympathetic nervous system. The other is called the sympathetic nervous system. These two divisions need to be in flux with each other. You need to be able to shift into parasympathetic when your body demands it, and shift back into sympathetic when your body demands it. So that's why I have this represented as a seesaw here. You have to be able to adapt according to whatever's going on in your environment. So Literally, flux between these two divisions is your body's primary means of adapting to the environment around it. Who in here thinks your body needs to be able to adapt to an environment? Adapting, it can be as simple as I go into a cold room and my body decides to shiver to generate more heat. Adapting can be also as simple as I eat something that my body doesn't like and it decides to throw it back up. That's a physiological, appropriate adaptation. All of those are governed by your nervous system. Your brain knows what it's doing. In the immortal words of Charles Darwin, it's not the strongest of the species that survives, nor the most intelligent that survives. It is the one that is most adaptable to change. Your nervous system governs adaptation. Adaptation is necessary for survival. Therefore, the health of your nervous system is essential for your survival. Dysautonomia is a term taken from the medical community describing imbalance of the sympathetic and parasympathetic nervous systems. Subluxation alters the balance between these two divisions and alters your body's literal ability to adapt to the stressors of daily life. So you could think of it as this. The seesaw is now tilted. You're not able to flux freely between those two divisions of the nervous system. Some people, you might be able to recognize the patterns here. Someone who's stuck in the sympathetic paradigm is more anxious, irritable, they're keyed up, they have tense muscles, they can't sleep because their body is always keyed up. Something I forgot to mention is the difference between sympathetic and parasympathetic. Your sympathetic division governs your response if you're having to run from a tiger. So your blood flows to all your limbs, you get ready to run, your pupils dilate. The parasympathetic division governs feed or breed responses. So if you have a big meal, you get sleepy, right? So sympathetic, anxious, irritable, tense muscles, insomnia, that would happen if someone were under stress all the time and looking like they were going to fight the tiger at all times. Conversely, parasympathetic dominance you can see as someone who has had a perennial Thanksgiving meal. They're sleepy, fatigued, they suffer from depression and stomach and intestine issues. These are two patterns that chiropractors see very often in people who have subluxations that have got them stuck between one or the other and unable to flux. So here's the question. That is a problem. How do we fix it? Turns out the chiropractic adjustment, removing subluxations, alters sympathetic and parasympathetic activity. It restores your body's ability to flux between these two divisions and gets you out of being stuck in one. This was some really nice research in 2008, sympathetic and parasympathetic responses to adjustments aimed at eliminating subluxations from the neck spine and the back spine. So you could think of health not so much as a state. I'm sitting here, this is health. But rather, health is a state of, it's a force, it's the power to resist and overcome the threats that we are going to encounter in our daily lives. Who in the room has ever encountered stress in the past week? Right. How did your body adapt to it? Appropriately or inappropriately? So here's another balance we're going to talk about. There is, I was talking about the difference between the autonomic nervous system, the sympathetic nervous system, and the parasympathetic nervous system. The other balance that subluxation derails is a balance between two types of neurological input. One is called nociception, the other is called mechanoreception, also referred to as proprioception. Mechanoreception is information your body sends to your brain, informing it of its position in space and time. It is literally your brain's awareness of your body. Mechanoreception is what is necessary for a crazy person to do something like that. I have to be very aware of everywhere my body is in order to hold that balance pose. Conversely, nociception is the equal and opposite to mechanoreception. It is the type of neurological input generated from a subluxated joint that generates static in a TB signal. So Here's an important distinction that I wanted to share with you here. I've described mechanoreception and nociception. Nociception, before we clarify how those relate to each other, nociception is not pain. Nociception, when it becomes loud enough, becomes pain, but unto itself it is not pain. So you can think of nociception as the part of the iceberg that's way underneath here. When it becomes loud enough, when it's been uncorrected long enough, and it becomes enough of a problem that your brain actually starts to perceive it, nociception becomes pain. If you had a problem in a subluxation in your spine, do you want to take care of it when it's nociception or when it's pain? I would prefer to make sure that I'm clearing out the nociception so that it never becomes pain, because nociception is something that really does derail your nervous system function from the inside out, and we'll talk about that in depth in just a minute. So pain is a conscious awareness of nociception, and it is a signal that you not only have a problem, but rather that you have had a problem for a long time. So when's the best time to correct a problem? As soon as you see it coming, right? Or if you don't even see it coming, if your chiropractor sees it coming, because that's what we detect, nociception. So nociception results from compromised joint function, subluxation, which is again what chiropractors work to eliminate from your spine. Importantly, nociception reduces mechanoreception. That input from a subluxated joint literally reduces your brain's awareness of your body. So the more nociceptive input, the less mechanoreceptive input. You guys ever seen someone with a balance problem? They're walking along and they literally cannot feel their feet. They don't know where they are. That could be a classic manifestation of excess nociception. Their brain cannot see their feet. When would have been the best time to take care of that problem? Way long before that. So, here's another question for you. Why is it that many elite level athletes consider chiropractic care integral to their performance, to their athletic performance? Because you want more mechanoreception and less nociception. You want to have your brain aware of your body. You want to keep that nociception as low as possible. One great example I can give you of that is, we're taping this in New England, by the way. Here's a New England classic, Tom Brady. One of my favorite quotes from Tom Brady is, "Chiropractic just makes you feel so much better. When I walk out of the clinic, I'm about 3 inches taller and everything's in place. As long as I see the chiropractor, I feel like I'm one step ahead of the game." Do you think it's important for Tom Brady to have very good control of his body as he's chucking the ball? I think so. So, very importantly, mechanoreception, the good input, can override nociception. This is a very central tenet for why chiropractic care is important to maintaining health. And most importantly, the greatest amount of mechanoreception from the adjustment comes from the neck spine. So when you go into a chiropractor and they say, okay, well, you go in with, I've got a problem right here, my immune system's not working right, I'm feeling tired all the time, and the chiropractor goes and adjusts your neck. And you're like, but the problem's here, why did you adjust here? This is one of the reasons. That when we generate mechanoreception with a chiropractic adjustment, we're overriding the nociception that is derailing your system. Chiropractic adjustment creates proprioceptive mechanoreceptive input and improves the brain's control of the body. This is from Melzack and Wall in Science. This is referred to as gait theory for anybody who wants to go do a little bit of research on that. So we're going to go back to this, communication in the body. If we're improving mechanoreception, we are literally also improving the brain's awareness of the liver, the kidneys, everything that it needs to maintain 100% control of. If you lost 2% of the communication between your brain and, pick an organ.
Liver.
Okay, if you lost 2% of the communication between your brain and your liver on a one-day basis, is that a big deal?
Probably not.
What if you lost 2% of the communication between your brain and your liver every day for 20 years? Do you think your liver is going to be healthy or sick?
Sick.
Right. That's one of the reasons that we want to make sure that that's a clear pathway. So another thing we're going to move on towards, I mentioned that nociception is something that is really important for the health of your body in general. So we're going to talk about that a little bit now. Nociception creates global effects on not just your local neurology, but on your global physiology. It's like a chain reaction. The weakest link in the chain determines the strength of the chain. A drop in a puddle will send waves. So global effects absolutely can come from local subluxations. So how might that happen? Well, subluxation, as I mentioned, generates nociception, which in turn activates a couple of structures in the brain, most notably the hypothalamic pituitary adrenal axis. It also activates the amygdala, but we'll get back to that in just a minute. Activation of the HPA axis causes increased synthesis of a couple of stress hormones, epinephrine, norepinephrine, and cortisol. Those stress hormones do bad things to your body. This pathway is replicated when nociception activates the amygdala in the brain. Your brain actually cannot distinguish between physical stress and emotional stress. All of that input goes to the same structure in your brain, and your body reads it as stress. Stress is stress. And we all know what stress does to the body. It can cause sleep disturbances, and it can cause increased pain sensitivity. So where am I going with this? Sleep disturbance will result in increased pain sensitivity, which will in turn result in muscle pain, which in turn will result in inactivity. If it hurts to exercise, you're not going to go exercise. Inactivity will in turn lead to muscle loss and lack of repair and regeneration. What are the two functions your body needs to do every day to stay healthy? Repair and regenerate. Sleep disturbance also leads to decreased production of growth hormone, which is necessary for repair and regeneration. So, this creates what I would refer to as a vicious cycle. There's another name for this cycle. Medical doctors have labeled this cycle fibromyalgia. But I think you can clearly see that the basis for much fibromyalgia might in fact be nociception causing activation of the HPA axis, causing sleep disturbance. Downhill slide from there. When do you want to take care of that problem? Before it gets here. Subluxation and nociception spark a vicious cycle in the body by not allowing the body to repair itself. Every time your body doesn't repair something, it becomes a cumulative problem. So what do we do here? Chiropractors aim to break the cycle. Reduce the nociception, allow people to sleep, allow the body to repair and regenerate. Who in the room thinks that's a good idea? Einstein didn't really say this, but I think he would have. So we're going to go on to another level of what nociception does to the body. Nociception is an internal stress. I mentioned just a minute ago, when stress hits the amygdala in the brain, it activates the stress pathways. So we have enough stress in our lives. I'm a business owner. I have 2 dogs, one of whom is insane, and I try to chase my whole life around, and I'm always doing one thing or the other. I have a lot of stress. I don't need stress from my spine. If they all go to the same place, to the amygdala, as a sum total of stresses, you kind of want to be able to reduce stresses in your body from wherever you can. So Roger Sperry was, we're moving on to another section here, how the chiropractic adjustment actually does activate the brain and help it work better. So Roger Sperry in 1981 was given the Nobel Peace Prize, in 1989 the National Medal of Science. He did a lot of studies on hemisphericity of the brain, left brain versus right brain. One of his quotes that is attributed to him is that spinal motion is the motor that drives the brain. The research was not around to support that contention yet at that time, but actually now it is. The input system runs the output system. So sensory input from the body to the brain activates the brain and makes it work better so that it runs the body better. Spinal motion activates the brain's state of alertness through a structure called the reticular activating system. If your reticular activating system is not given input, it goes to sleep. Anybody see people walking through life like they're zombies? Yeah. Probably their reticular activating system has not been given enough input. And why might that be? Because input to the brain from spinal motion is the neurological equivalent of keeping things sharp, like Sudoku, like crossword puzzles. And when you're subluxated, a subluxation is a motion aberrance in the spine where things are not in the appropriate motion relationship or they are outright stuck in the spine. If that segment is stuck, it's not feeding the brain. What if you have 5, 6, 7 subluxations in your spine? Those are all basically silent. They're not feeding the brain. Is your brain as active as it should be? Is it getting the motivation and getting the input that it needs? No. So, a lot of Americans, unfortunately, their job involves sitting. What's that doing to our brains? This is one of the reasons that sitting is one of the worst subluxators on the planet. Sitting is to your spine like sugar is to your teeth. You have to move your spine. If you don't move it, it will get stuck. It will get subluxated. So, one of the things that everybody who is watching this should make sure they do is put your spine through its full range of motion every single day. Exercise. Yoga, running, CrossFit, whatever floats your boat. Move. Just move it. So, another thing that activates your brain is the spinal adjustment, because it creates this signal called mechanoreception, hits the reticular activating system, and activates the brain. One of my first patients, Corey, this was just a fantastic but kind of scary story when this happened. I knew she was very subluxated, and one of the first adjustments that I helped her with was a C6 adjustment, right at the base of your spine here. C6 controls the nerves down your arm, and it also controls some important structures in the front of your neck, including your thyroid gland. It also sends input to the reticular activating system. Corey had anxiety, and I always felt like she was living in her life through a fog. Well, what happened was when I released that C6 subluxation on her, her first response, she laid there for a minute, and then she started crying. And I'm a brand new chiropractor. I knew I'd done the right thing. I had followed the protocols, that I had followed the findings. I knew exactly what I was supposed to do, and I knew it was a safe adjustment to do. And yet she was there crying. So I said, "You okay? What's going on?" She's like, "Everything's clear." "What did you do?" "Everything is clear. I have been living my life in a fog. All you did was adjust my neck, and everything cleared up." Isn't that an experience that more people deserve to have on this planet? This is why I need all of you to understand this information, to offer it to other people, so people know that this is a possibility. Imagine the number of people who are going through their lives in a fog because they're not getting enough mechanoreceptive input to activate their brain. Simple as that. So last but not least, some of the most new and fun research that's coming out is on chiropractic care and a health index called heart rate variability. Heart rate variability is as important as blood pressure or heart rate. Heart rate variability literally measures your body's ability to adapt to different stressors. You don't want your heart rate to be flat, 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 flat. You want it to be able to go up, go down, go up, go down, according to what it sees in its environment. So someone whose heart rate is very flat doesn't have a very big adaptive potential. Whereas someone whose heart rate can go up and up quickly, down quickly, they are better able to adapt to their environment. So the research that's coming out lately This was a paper in 2006, and there's been some research since then. 2009, this is JMPT, and both JMPT. Heart rate variability is controlled by the nervous system. All adaptation is controlled by the nervous system. So it turns out that heart rate variability improves with chiropractic care. Your body's ability to adapt improves with chiropractic care. This is why I am a very fortunate person. I love what it is that I do. I get people to be I get to help people be healthier from the inside out every day, without drugs, without surgery. All I do is identify and eliminate subluxations from people's spines, and they get healthier. And now you see the science behind why that happens. So, one more thing I wanted to talk about. Obviously, you see that subluxation is clearly a health problem, and that the chiropractic adjustment counters that health problem and helps your body to be healthier. So, one question that I get is, okay, I get that subluxation is a problem. Why doesn't one adjustment fix things? The reason to that one adjustment doesn't fix things is a very important reason to share with you so you understand what the process of your care is. It's a term called neuroplasticity. And the data that I'm going to show you here is from a very different field. So neuroplasticity is the ability of your nervous system to learn patterns. It is the ability of your nervous system to learn words, learn sentences, learn an intricate dance. Your brain literally learns these patterns, and then it solidifies them. So we call this muscle memory. You learn how to do a task. Every time you do it better. This has been shown through many different fields. Long-term potentiation is a form of neuroplasticity that has been shown since the 80s and 90s, which is very important. I don't know if any of you noticed the last name on the first author of the second study. That is not me. That is my sister. She is an assistant professor of neuroscience at Lehigh University. This is her paper that she published in Science 2 years ago. This is showing that 2 different methods are used within the nervous system to literally generate and maintain patterns. So, here's a question for you. If you're subluxated, if your brain has learned to hold your body in an aberrant motion pattern, in a bad subluxated state, doesn't it learn how to be there? The more time you spend subluxated, the more you reinforce those patterns. So when someone goes into the gym after not exercising for a long period of time, you think that takes a little while to get that muscle memory up to speed so they're in better shape? It's similar with chiropractic care. We adjust a patient. The patient will relapse slightly, not completely, but slightly, because of their neuromuscular memory. Then we catch it before it fully reverts, and then we push them forward with another adjustment, which restores better muscle memory and starts to eliminate the old muscle memory. This is a process, not an event. This is why I see my patients fairly often, and I follow their findings to make sure that their subluxations are clearing with time. This is why when you're adjusted at first, it doesn't hold all that well. And this is why later on your adjustments will hold very well and will change your life. So the more time that we can get a spinal motion segment to spend unsubluxated, the more likely it's going to want to be there. It's a matter of actually correcting the problem. And here's a question for you. I am pretty much a Mac person, so I don't really deal with a lot of PC issues anymore. I used to. I used to have to defragment the drive, go through antiviral, go through all these nightmares just to make sure it was working adequately, right? When's the best time to defragment a drive? Before or after the hard drive crashes? A little bit before. So here's my question to you. You ever hear of a spine transplant? Yep. So you better take care of the one you have. In some, subluxation does bad things to the body in many different ways. Chiropractors aim to counter that by correcting the subluxation that is doing bad things to the body. Because the bottom line is that your body was built with everything it needs to be healthy and flourish. If you don't believe in miracles, I want to remind you, you are one. You were born with the ability for your body to be healthy from the inside out. Rather than consider, if someone has a diagnosis of X, Y, or Z, a label that they're broken, maybe it's time that we start thinking about how healthcare would handle that problem. Rather than label the person broken and say, you need this, this, and this, maybe we should look at them and say, why did that happen? What is your body missing that it needs? What is getting in the way of your body handling its own problems from the inside out? Subluxation subluxation is effectively a roadblock. It's a roadblock that's preventing your body from doing what it does best, heal from the inside out. So, in sum, chiropractic adjustment helps your body to work better by improving communication between the brain and the body, by stimulating mechanoreceptors and literally activating and feeding the brain. It improves the structure of the spine to improve blood flow and oxygen supply to the brain, and it reduces nociception and internal stress from the inside out. These are all things that are very important to make sure that your body is working as well as it possibly can to handle the stresses that you're going to come across. So, make sure that you maintain your body free of subluxation by seeing a chiropractor. We are the only doctors whose specialty is detection and removal of subluxation. No one else does this. This is why every person in the US needs to have, and elsewhere, needs to have their spine checked for subluxation, because it's a health problem. It's a very global one, and this is what we're willing to help people with. So what's the take-home message? Subluxation literally does throttle the life right out of you. Slowly. You may not feel it happening, but it is happening. Every adjustment helps your body to work better from the inside out, physiologically, neurologically. The best time to correct a problem is as soon as possible. Don't wait till it becomes something that cripples your body. Find a problem, find a weed when it's a small weed, before it becomes something like bittersweet or kudzu and takes over the world. It's much easier to take care of a weed than something that's overgrown the garden. So here's another question for you. What is the value that you realize from your chiropractic care? Inestimable. The chiropractic adjustment is a unique and indispensable means to correct neurophysiological problems in the body, either before or after symptoms arise. And here's what I want you to do. When I started this presentation, I mentioned that I have difficulty when I hear someone say, "Oh, I believe in chiropractic." And I charged you with listening to this presentation with an ear towards understanding how to answer that question. Here's your homework. Knowing what you do now, when someone asks you why you get adjusted, what will you say to them? What would a good answer be? Here's my ideal answer in an ideal universe. What I would love for you to say with the information that we just discussed here. Subluxation decreases health and vitality like dimming a light. My chiropractic care eliminates that subluxation and helps my body to work at its best. Isn't that what you want for your body? So that is all I have for you today. I hope I have fed your brains, and I want to thank my resources. A lot of this is drawn from the work of James Chestnut, Christopher Kent, and Mark Amos, one of my favorite instructors at Life University, and with the help of one of my classmates, Luke Gafkin, who was instrumental in getting some of the neurology behind this straightened around. If anybody has any questions, please do feel free to email me at path.of.life.chiropractic@gmail.com. Thank you guys for coming. I'm glad that I was able to share all this information with you.